myself. My name is Anita Reynolds. I'm the Manager of Grassroots Advocacy and Community Partnerships at NPAF. And I'm excited to spend this time with you all on exploring on how social media can help us reach more people and to share our patient experiences, but also help strengthen connections in our own communities. To help us have the best experience today, I'm going to share just quick housekeeping items. Now, this session will be recorded and we'll share the recording as well as slides after the meeting. We'd appreciate if you remain muted during the session to help minimize the background noise. And you can also submit questions at any time and we'll address them during the Q&A at the end as well. And if you experience any technical issues, please let us know in the chat, or you're welcome to email us at action@npaf.org. Now, today we'll hear from two of my amazing colleagues, Melissa Williams, she's our Grassroots Director, and Kiva Thale, she's our NPAF's Digital Media Consultant. And together they're going to share on how NPAF uses social media to not just amplify patient voices, but also show you how your online engagement can really make a true difference in our communities. And with that, I'm excited to introduce our Grassroots Director, Melissa Williams. Melissa, over to you.
Amazing. Thank you so much, Anita, for that welcome, and hello to all of you. Hard to believe that it's October 1st, but here we are, and we just really appreciate you all spending this afternoon with us as we talk a little bit more about social media, specifically how NPAF uses it and some things that you can do to help us. And so with that, just a couple objectives that we want to go over in terms of what we're going to be covering here today as part of this webinar. We're going to talk about what we know is working in terms of social media. So learning how NPAF uses the platforms to raise awareness, and just some lessons that we've learned just in the last year of just regularly posting online. We have some ways that we're going to explore how you can find your voice online. That is to share stories, spread resources, educate your communities as volunteers or as people that are a part of our network. That is one thing that we think anybody can do. And so we're going to talk a little bit about what that could look like. And then we also have some take-home tools, including a toolkit that we will share with you in follow-up to this webinar, just so that you can effectively and confidently advocate online. And so before we go into just the meat of this webinar, I just want to acknowledge and just come out and say that, like, I am someone who has just really mixed feelings about social media. By no means am I an expert. If my family or friends knew that I was doing this webinar today, that I was speaking about social media, they would probably just laugh, because I'm not on Facebook. I recently deleted my Instagram because it was just so overwhelming for me. But all to say, I absolutely acknowledge that social media can be used as a tool, and it does have its value. And that's just something that I'm kind of internally grappling with, and we may unpack that along the way. But I just wanted to say that from the get-go, that we're not experts. I'm not an expert anyway. Key is way more of an expert than I am. And that we're still figuring out our footing. So if that provides any comfort, just know that you're not alone in terms of just those mixed feelings about social media, because that's where I'm at. I want to start, though, by just giving some background about why we want to use social media. If you've been a part of any of our virtual meetings, whether it was Policy Consortium or some of the previous webinars we've held this year, you may have seen these data points before. And really, this is data that came from a survey that our colleagues over at Patient Insight Institute did earlier this year with their network of patients and caregivers. And these are some of the staggering statistics that came out of that. 77% of those patients and caregivers identified financial distress as their top worry in healthcare, ranked above the possibility of dying. Now, this data point is not, if you've been with NPAF for quite some time, this may not be a new talking point for you. You may have heard this before. This was actually part of another survey that was done 5 years ago. This, 5 years later, it still holds true. Financial distress is a top worry in healthcare. 82%, moving on to the next data point, 82% experienced financial difficulties in the past year because of expenditures related to medical care, insurance, cost of living, what have you. Again, super, super significant in terms of just the number of people who've experienced financial difficulties because of healthcare. And then we have 89% of patients and caregivers who say that needs navigation, which is a model of care that eases cost concerns, and we've been advocating needs to be everywhere. 89% of people have also said that this type of care should also be available to everyone. And so I wanted to just start by giving this background in case this is new to you, or just to provide that reminder, because this has really been the focus of what NPAF has been working on over the last couple of months. Our main message really is that financial hardship is a sad reality for most patients and caregivers. And that financial hardship is also part of the healthcare experience alongside physical and mental health. Financial hardship is common. And this is our main message because we feel that so many of the stories we hear from patients and caregivers are just, we hear so many of them. Maybe many of you have your own stories related to financial hardship. But it's almost as though like this is, people are surprised that they're experiencing this. Many people say like, I did everything right. I paid my premiums on time, and yet I am still falling into debt. Financial hardship should not be treated as like this outlier. We need to recognize that it is something that almost everybody is experiencing, regardless of whether they're insured, regardless of income. This is something that's pretty ubiquitous, and that's actually not okay. And that's part of why we want to get this message out. We need the public to know that they're not alone. And we need policymakers to understand, and policymakers, decision makers, we need them to understand that financial hardship is a common problem and it needs a solution. And in fact, we worry that this is just going to get worse. So with that, just some of this level setting that's happening right now, one of the things that we think you all can help with is to share this message with your communities, whether it be at your home community, like at home, in your neighborhood, in your school community, or it could also be online. And that's the focus of this webinar today, is really focusing on how you can share this message with your community online, specifically in social media. And so with everything that I had shared at the beginning in terms of my mixed feelings around social media, we know that this is just the reality today. Many online spaces can feel really noisy and crowded, and sometimes it's hard to take in all of the information. Sometimes it's just, it's hard to understand what's real and what's not, what can be trusted. Those are all very real things that are happening in the world of social media. And I also find it interesting that a lot of actual media, actual news, stems from what's happening on social media. They're like breaking news because someone posted on social media about something, right? Like that is part of our reality today. Um, so we know this is the case, and you're probably wondering why, if online spaces are noisy and crowded, like what's NPAF gonna do about it? We know we're fully aware that we're not gonna make like the biggest dent in terms of changing how people interact with social media, but we just want to give this guidance that social media is one of many tools in our tool belt as an advocacy organization. And our approach to it is really to help get the right information out. We also use social media to help build community. It shows connections. And it also is one way for us to get noticed. And that's why we think this is where you all can come in as advocates, as volunteers, to interact with our posts online. And we're going to just talk a little bit about how that can be done, but all to help us get noticed. We know that we're probably not going to have a post go viral. Would we love that to happen? Absolutely. That would be great. But what's most important for us is that we get the right information out. And I'll talk a little bit about why that is so essential, especially right now. And so if you've been following NPAF over the last year or so, you may have noticed that we've been posting with a lot more frequency, a lot more regularity than we have done previously. And a lot of that is thanks to Key Bethile, who you're going to hear from momentarily, because they've brought their skill set and their knowledge about how social media works to us. And some of the things that we've learned is that the informational posts that we've shared are really our cornerstone. So many people engage or respond to those posts, and I'll show some examples of what kind of posts those were. We also have heard from so many of you that advocates and allies from all parts of the country are just looking for spaces to connect. And we want to help cultivate that, help support that, because connection keeps this movement going. It keeps this conversation about financial hardship hurting health. It keeps that going. And so with that, some of the posts that got traction just over the last year were related to the ACA open enrollment, which is coming up in actually in exactly a month. We're going to hit open enrollment season again. We had many posts about protecting Medicaid and how Medicaid works, busting myths. And those posts, again, were ones that really got traction. A lot of people shared them and felt that that was helpful to educate their networks about here's what Medicaid's really about. And we also had a post about just what actions you can take right now to support patient advocacy in your community. And those types of very simple graphics, but just things that really get to this message of like, here's what you can do, are things that we saw really take hold. And this is just another reminder here why social media works for you and for us, and why we think it's a really great action for anyone to take. It can be done on your own time. It helps us be seen, and it can show connections. And I didn't have this in time, but there is this infographic that I've been working on that really shows just in all of the options that you can do as a volunteer with our organization. Social media is something that anybody can do. It's super accessible. Again, can be done on your own time. And the impact can be really, really high. You can help just expand our reach. Just there's this domino effect that happens with social media. And we'll talk about that more, but it's one of the reasons why we really feel that this is an important tool for us to use. And some of the examples that I really want to highlight now, beyond the informational posts that we shared, are these stories that we were able to gather because of social media. If you followed us earlier this year, you've seen our push around protecting Medicaid, and we did some really big story collection pushes about the importance of Medicaid and protecting it and what it means for patients and families, no matter where they are in this country. And we were able to get some really, really compelling stories. And all of these stories that we were able to collect, not only did we get to amplify them on social media, but we were able to use these as part of this larger library that we are starting to build, that we're able to take these stories and bring them to coalitions and use these stories as part of coalition letters. We've been able to use these stories to get the attention of leaders in Congress to help them understand here's what's really happening to individuals for those who are on Medicaid. And I want to share this next infographic to really illustrate what it means in terms of having your stories and how it can just help influence these different systems, whether it's building educational tools that our sister organization, Patient Advocate Foundation, works on, or influencing research or practice standards, advisory groups and policy. Like, all of these are ways in which your story, your voice can really help make a difference. And we're here to amplify that. And again, social media is just one of those ways in which we can really expand that reach. And so I'm going to now turn it over to Key, my colleague, and our NPAF's digital consultant, who's going to share a little bit more about how you can find your voice online. So with that, Key, I'll turn it over to you.
Hey there, everyone. My name is Key. Thank you so much, Melissa, for giving all of this background that is super important to understanding the social media and media landscape in general we find ourselves in. Just a little bit of background about me, as Melissa said, I am the NPAF digital media consultant, but I also have the pleasure and privilege of leading our media working group. And that is a space where we are actually able to come up with all of these great ideas behind our social media posts and workshop them and figure out the best way to get our information out there in a really fun, engaging, and just poignant way. So if you have any interest in being part of our media working group, be sure to reach out to us at action@npaf.org, or even just leave a comment on any of our posts and we'll be able to get back to you, because you too can be a part of this. Yeah. I guess next slide. Oop. All right. So before we get going, we'd love to hear from you. What digital spaces, if any, do you find yourself on often? And we're going to throw up a poll so we can hear from you. Just give us a moment there. Do you have the poll up? I didn't get the push notification.
We do have the pull-up key.
Okay. It's probably just me because I'm presenting. I don't get to see the poll. I'm excited to see your results in a second.
Okay, I think I'm gonna go ahead and
Yeah.
share,
The
and we're going to share the results.
So, wow, okay. This is somewhat, but not entirely surprising. So it looks like 65% of you use LinkedIn, 65 also use Facebook, and 65 use Instagram. A little bit more surprising is that 69% of the folks here use YouTube on a regular basis, and that 19% of you all are on Reddit and Substack, as well as some others. What's even more surprising to me is that nobody answered that they are on none of these platforms. So I'm glad to be speaking to you guys today because we'll be able to run with this information real quick, it seems like.
I would also like to ask if those who wrote other or clicked other, would you mind sharing it in the chat as well so that we can know what other social media platforms you're a part of? Thank you.
TikTok, we know. We're thinking about it. So, besides TikTok, and you may have seen us on Blue Sky as well, our cornerstone platforms are all listed here. So, one of the reasons I was so excited to see that so many of you are on LinkedIn, Instagram, Facebook, and YouTube is because those are currently our primary platforms. And as Melissa said, social media is really one of the many tools in our toolkit that we are able, or the tools in our toolbox. I guess toolkit has a separate meaning sometimes, but the tools in our toolbox to get our information out there and to have a presence of trusted information in the social media space despite the crowd. So we've got all kinds of tools in a toolbox, right? Including something like a screwdriver, which might literally be something like going out to your neighbors and sharing the information about your information, or the wrench of seeing somebody in the coffee shop and talking to them about, your particular financial struggles. I like to think about social media as a drill, specifically because it has lots of very fine-tuned attachments. So just like a drill, which each individual bit that you might use for a different purpose, each platform has its best used function. And while there's lots of information that can be shared across the platform, to really carry our message effectively, it's important that we tailor the specific content to the specific platform so we have the right bit for our drill to do the job. So on LinkedIn, which is really currently one of our real primary location, largely because it offers us a way to network and build capacity. On LinkedIn, the purpose is really to build professional community, share important news in our industry, and find these partnerships and connect on a professional level. And our meta platforms, which are Instagram and Facebook, these are real community building sites, but also places to take in information. So you're going to be sharing those graphics, you're going to be sharing those resources, but it also is a great place to put out calls to collect stories, because it really is a soapbox to stand on with a megaphone. YouTube is a little bit different. I'm excited that so many of you guys do use YouTube regularly, because YouTube specifically has the function of acting as a story library and a resource collection library. So it's a way to, just like you go into a library of books or a film library, you go into YouTube, and we're going to have carefully cultivated playlists that can teach you about a particular topic or help support your advocacy work in real life and online. We are also launching, or have just launched, and you guys will be actually able to see our very first post on one of them shortly, Reddit, Substack, and Substack. Both of these spaces occupy a different niche. Reddit is a place that is purely built on connection. So we can really, really actually focus on community aspects and gaining information from one another and having these conversations, and not just in the comments, but as the content itself. And beyond that, many of you also said you use Substack, which will be an extension of our blog and newsletter and give us that functionality of being part of a feed as you would on any other social media platform. And just to quickly plug our private, secure social media platform, Mighty Networks, which is open specifically to our volunteers. So anyone who is able to attend a working group meeting will have access to Mighty. It's where all the workshopping gets done. And it's also a great place to find peer support in a more private capacity. And you will have access to this platform guide in the toolkit as well to come back and refer to. So just to qualify these a little bit, as we saw, each platform has a different specific purpose or best use, but it's also true that there are different people or different powers driving each one. So certain ones are spaces that are heavily cultivated by NPAF. LinkedIn is one of those. YouTube is one of those. Facebook and Instagram are also one of those platforms where we are putting content out for you to engage with and reshare. Yes, community can be built in the comments, but you're engaging a lot of the time with content that we put out there. On the other hand, Substack, Reddit, and in some ways Mighty falls into both. We'll get to that later. Substack and Reddit are really driven by our community of volunteers entirely. So we can put out prompts and questions for you to engage with, but it's your writing, your response to these threads that actually creates the content and creates the center of community. We'd like to give you an opportunity to, of course, either scan the QR code or go to this link, which is available in the chat. Thank you so much, Anita, to shoot us a quick follow. So everybody interacts with social media a bit differently. I certainly am not somebody you'd expect. For example, I don't have a TikTok account. I'm gonna say that right now. I don't have a TikTok account. I am not somebody who's often on Facebook or Instagram, and they just aren't my favorite places to be. But I know that so many people are on there that it's very important that we stay engaged on those platforms. I myself find myself mostly on Reddit and Substack. Right? Crazy social media person, but I also have my preferences. So that is to illustrate the fact that each and every one of us is so different, and each and every one of us has our comfortable spaces. And even more so, each and every one of us has a particular persona that we exist in online. So there are 5 of them, and people can be a combination of these. But once you identify which persona you lean more towards, we can then delve into what particular actions you can take and are most comfortable with in participating in the digital landscape. So first up, we have the influencer. This is one you're probably all familiar with. This is somebody who, like, you see their face on your feed. They are creating the content. They are sparking interest in the movement. They are like a champion of the cause, and they have no problem with their face in front of the camera. They, it's all about bringing attention to the movement and propelling our movement forward. Just keeping that momentum going, using their own stories and their personal experiences as the content. But that's not for everybody. I get it. Trust me. Last thing I'd want to be is a professional influencer. But if you are somebody who loves that level of involvement and engagement in social media, but maybe don't want to be making videos about your own personal stories, there's still so much you can do. So then we have the crowdsourcer. This is the person who's still highly engaged on social media, but maybe they're not posting pictures or any information about their own experience. Instead, they're the person who might be posting polls to get information. They're the person who might be in the comments asking questions, building community, and telling people about NPAF. The crowdsourcer is somebody who has a lot of face time with NPAF in that you are able to share this, what you're finding, directly back to us. So both in our toolkits and in our working groups, we do build tools out that crowdsourcers and others, but specifically crowdsourcers, when it comes to polls and prompts, can use to go out into their preferred platform and actually themselves engage with the community and report back about what's working, what isn't, what people want to see, just all this information. They're real boots on the ground in the digital space. So now we're getting into some more of the average bears here, which I think is the best thing to be. So there is also just sharing. What I love about being a sharer is that you're just curating the information. You get to repost what you like, skip what you don't, but every time that you decide to repost, whether it's directly on the platform or posting something directly from onto your account from our toolkits, you are amplifying your post not only to your followers, but it actually increases the visibility throughout the platform. Just the fact that the content is out there is so major. And in my opinion, the best part about this is it only takes a few seconds to a few minutes. So you're able to have a massive contribution on your time and with a very small amount of time. And of course, there's the liker, which is also still incredibly valuable. Most folks don't realize how this kind of engagement actually drives our viewership. So this is the person that, enjoys scrolling on their favorite platform and likes the content. And maybe sometimes they even comment. Those comments are extremely helpful because they do drive the conversation forward and also just help to make sure that the post remains visible in the feed. We do have one last one, which is near and dear to my heart. So shout outs to all the wallflowers out there. You might be somewhat invisible online, but we know what you're doing is still important. So this is somebody who rarely posts or literally might never post. Like that's me on Facebook. I have never posted anything on my current Facebook account, but I'm there. I gotta lurk a little bit. Some people might know this. We talk about them as like lurkers or ghosts, but we like to think about them as wallflowers because what they're doing is extremely important. They're literally just consuming the content. But what's great about that is that they're seeing the content, they're following us, they're staying in tuned, and they're staying ready to receive information. Even if they don't repost it on their feed, they can take a screen cap and share it with their friends. What they viewed on the social media feed is now information that they carry with them into the real world. So even just looking at the content gives you a first look at all this very important information that can help make healthcare really work for all of us because we are spreading all this important news and all these important tools. So, which persona are you? I know what I am. What about you guys?
So if you had share Jacqueline, she's a sharer, but also you can click multiple. I'm a little bit of all sometimes. It also depends on the message.
All right. Woo! Okay. I love this. This is like it's a widespread, guys. So about a quarter of you are consider yourself influencers, which is awesome. I know that when social media started, it was expected that we were all going to be an influencer. Before there was a word for being an influencer, the thought was we're all going to share our own stories. Who would have thought that it was going to turn into something where you don't even have to do that to fully participate in it? And we love that we have 20% of us are crowdsourcers and 45% of us are shares, which is so valuable because just with one click, you are getting the information to your followers and boosting it in the algorithm. 30% of you are likers, and only 20% of you are wallflowers. I'm surprised. I'm surprised. But we love you, wallflowers.
It's a real like bell curve, the way it's shaped.
It
It's really interesting,
is.
right?
I know. I'm surprised we got so many influencers in the house.
All right, so we're gonna jump to the next part of this webinar, and thank you, Key, for really breaking that down. And I think it really gave all of you a chance to see where you fit within the larger social media ecosystem. Um, some of the things that I would just want to call attention to in terms of how we're going to be using social media and why these personas are going to be so essential for the things that are going to come is basically the campaigns that we have focused on. Our long-term goal, as many of you know, is to scale needs navigation so it's accessible everywhere. If you've been with us throughout the year, you may have even seen or engaged with some of these posts related to needs navigation, and that's not going to stop. That's going to be a couple of years of you're going to keep seeing us talk about needs navigation, and we're going to continue to want stories about why needs navigation is so essential. But because of everything that is happening right now, we have a new social media campaign that we're going to launch in just a couple of weeks. We're actually going to start one today on this webinar, and we're calling that hashtag Get Care, Get Covered. If you've been with us as a volunteer in the past, you may recognize the hashtag Get Covered campaign because it's one that we've been working on since I think it's been going on about 8 years now. But with a lot of the changes that are happening, I think most top of mind right now with the government shutting down, all related to the premium tax credits that may likely expire by the end of this year. We just felt it was really important for us to build a social media campaign about the importance of not just getting covered, insurance coverage, that is, but also getting care. And so just know that this is a campaign that's going to launch in a couple of weeks. ACA open enrollment starts in exactly 1 month. and we need all the help that we can get to make sure that we get the right information out. And this is so critical right now because, as we talked about at the beginning of this webinar, we are being flooded with so much information. And it's really hard for the average person to kind of piece through, like, well, what's right? What do I trust? What do I believe? What do I even follow? And so we've taken it very seriously here at NPAF to really parse through all of that information, to kind of cut through that noise and really make sure that we are getting the right information out and really relying on you all to help share that. And so another reason why we are really launching this as a social media campaign is because we've just heard through our coalition partners that so many of the people who work as navigators, as people who are helping to assist in enrolling people in an ACA marketplace plan, so many of them either have had their positions cut, or they're just so overwhelmed with phone calls that they're not able to answer all of the calls. That if there's anything that we can do to just make sure that we're getting, again, the right information to the hands of consumers, to the hands of patients, that's one way for us to maybe ease some of the frustration that comes with waiting online or being on a queue, waiting to get a hold of someone to talk about whether or not, like, do I need to worry about my premium tax credits expiring? And so all to say, this is something that's coming, and we will be sharing this information with all of you very soon. But while we have you, we thought it would be really great for you all to engage on a post that we just posted shortly, like a short time ago, on 5 things you can do right now. And so, Key, I'm going to turn it over to you. I think you were the one who scheduled this post just so that it could align with this webinar. And I think based on your persona,
Me?
we're just asking them to
Yeah.
either like, share,
Yeah.
comment, right?
Engage in any way, whatever you're most comfortable with, even if it's just looking at the post. We'd love to see you open up the app or your desktop website and go and follow us at NPAF so you can see the post. And
And we're
this
gonna
is, just
get
so you guys, historical moment. It is our first Substack post, so you guys can be a part of that.
Oh, that is fun. All right, so I'm gonna, as someone who is reluctant to to post on social media, I am gonna go on LinkedIn right now and like it and share it, repost it to my feed. Um, and hopefully others will join me as well. So give a couple minutes for that.
I am already getting the notifications. Thank you everyone for sharing it.
Amazing. All right. Well, that was fun. There are going to be more posts just like this that we are going to be sharing throughout our social media channels. And I also just want to give that shout out to the media working group that Key helps facilitate, because they are the brains and just creative minds that are bringing these posts to life. So thank you. And I know they're going to be busy making sure we get these assets so that we can share with others in our network. All right, so Key, I'm going to turn it over to you to talk through just this element of sharing, story collecting, as it's such a critical part of really any advocacy organization, but especially our organization, because we really take heart that we want real people, and authentic stories. There's so much out there that's really artificial right now that we really take pride in, like the stories and the real experiences that we're able to get from people like you who are a part of this webinar. And so, Key, I will turn it over to you.
Thank you, Melissa. So it's so true. it's the wild, wild west out there right now on social media platforms. And that's one of the many reasons that we continue to work on gathering stories to lift them to the places that matter. Um, as you're probably well aware, a lot of folks take it to their own accord to post their story on social media and hope that maybe it'll go viral and it'll reach powers that be. And that does happen. Like we do know that happens. It happens from time to time where a story really does go viral. And it can change the landscape. As Melissa said in the beginning of our conversation here, these TikToks will end up on CNN and spark an entire week of coverage about what somebody said in their video. But what if you're not an influencer, and what if you still need your story to get out there? Or what if you're like me and I don't want to talk about my stuff on the internet, but I still really, really want to share my story? Well, we have an answer for you. So your story is so important, and it is the cornerstone of changing this system, because not only do we get information about what's working, what's not working, and what you want to see, but your voice and the fact that it's coming from you adds validity and identity into the fold here. Because now it's not just everybody can't afford their meds. Everybody can't afford transportation. It's this person on this day experienced this hardship. And boy, was it painful. And nobody should have to go through that. And nobody should have to go through it alone. So we're going to go into speaking a bit more about Boast, which is our platform that allows you to share your story privately directly with NPAF. And I've done a little video walkthrough or a little screen capture of how to share your Boast so that we can all see what it's like.
Platform that National Patient Advocate Foundation uses to securely collect your stories and share them to the places that matter. It's a quick, simple, and comfortable process that's easy to do right from your own home. And of course, on your own time. This form is collecting stories about how financial hardship hurts health. The form starts with just a few pieces of information, including your name, where you're from, and what role best fits you, a little bit about your household income, and about the impacts that either caregiving or your experiences as a patient have had on your ability to work and have income available to you. While there's some tips to record here underneath your video, you'll find far more tips in our social media toolkit that is available for download at npaf.org. We ask that you review this toolkit before recording your video, as it will leave you best prepared to share your story. Let's say you don't want to record a video. You don't want your face in our archive. No worries there. Right in here, you have the ability to share your written story within the form. You can also do a voice recording and send it to us at action@npaf.org. A few quick tips are just that you should record in a quiet place, make sure we can see you, that you have decent lighting, and that your face is centered within the frame. We also ask that you take pauses when speaking, because it helps us organize the videos. And last but certainly not least, to protect your privacy, we ask that when you record your video, you use only your first name and refrain from sharing specifics about your diagnosis, prescription medication, particular institutions that have caused financial hardship, or providers. This allows us to share your story as far and wide as possible. It's really important that your story is authentic to you and that it is your truth. So after you've reviewed the toolkit, it's time to record your Boast. You can either record a video separately and upload it, or we can record right in the app. If you don't like your video, you have a chance to re-record it. So there's no pressure in recording this video in the app. So let's get to it. Of course, we have to remember to start recording. Hi, my name is Key. I'm from downstate New York, and I am a patient caregiver and advocate. And I'd like to talk about how financial hardship has hurt my health. Financial hardship has been something that has clouded my life for as long as I can remember, and it's really a problem that none of us should have. When you're a caregiver, when you're sick, ideally, finances are the last thing you should be worried about. And surprisingly, there are programs out there to help, but most of us aren't able to have that information. So when I think about what real financial wellness and healthcare looks like for my community, to me, it means having access to all of the resources available, and for those resources to be spread far and wide. I'd like to live in a world where no matter which doctor you show up to, no matter what hospital, no matter what pharmacy, all of your options and your resources are available to you in easy to understand formats. I am so looking forward to hearing all of your stories about how financial hardship has hurt your health, because these stories and your sharing them gives me hope that we can affect change and make healthcare work for all of us. So we stop recording. The video is now uploading, and it's ready for submission. Here, you can give us a few words about how financial hardship hurts your health and what you'd like to see based on the prompts above, or you can tell your whole story. Next, you can submit a photo if you would like, but you do not have to. So I'll use my camera. Oh, I don't like that one. Let's retake it. And of course, we click agree, and we submit.
Yeah, so it's really easy. Like it's pretty easy. I'm not going to say that it's like anyone can do it, but it's relatively easy. And of course, if you ever have any questions about using Boast, we're always here to help. So you can email us at action@npaf.org, and we're more than happy to walk you through it. These stories are incredibly important to us, and we will go to great lengths to collect them. So we'd like to hear from you, just right before we get to your questions and a quick comment. Let us know in the chat. Have you ever really felt seen online? Have you felt connection because of social media? Have you posted something that actually somebody told you that it helped them? We're really interested in understanding how these online connections have allowed your advocacy to be pushed forward and also revitalized your spirit, maybe that finding these connections online really recharged your batteries in a way that allowed you to keep pushing forward with the movement. And with so we're getting those in the chat, right? So, okay.
We can get in the chat, and I think you had mentioned, I think, was it Emma that wanted
Yeah.
to share?
Emma, if you are still here, we would love to hear what you have to say. Emma is one of the key members of our volunteer working group and is just very, very insightful when it comes to social media and is a TikTok user, unlike me.
Hi, yes, I'm still here, and I am definitely an avid TikTok user. It's a little frightening sometimes, but I love it. And if anyone ever has any questions on TikTok, please let me know. I would love to answer them. Yeah, so I'll go ahead and get started. My name's Emma Romano. I'm from West Virginia. I actually just recently graduated from the University of Arizona with a Bachelor's of Science in Molecular and Cellular Biology. A little bit about me. Super funny. I'm actually not going to med school. I'm not going to be a researcher. I decided to do something completely adjacent, which led me to NPAF. I'm actually applying to law school. I'm trying to do a law degree and also get my master's in public health. But right now I'm in a year off trying to make that transition so I can study for the LSAT, get all my applications together and head to law school next fall. So right now I'm actually working as a volunteer with the NPAF Media Working Group, and I absolutely love it. It has really all of my interests combined in one. When I was at school, I did a lot of rotations in different clinics and different areas of medicine and healthcare.
And I realized there was a lot that was missing, and a lot of that was communication to patients and, helping them understand their treatments, understand their medications, and also just understand their options. So that's what really led me to going to law school so I can hopefully advocate for patients and also work on the healthcare system at a more institutional level so it works better for everyone. And that's also why I'm here at NPAF, to help communicate, what we are seeing in healthcare to people across the nation and make sure they have that information at their fingertips. So today I'm really just going to talk really quickly about kind of the good, the bad, and the ugly about social media. So I always love good news first, so we'll start with some good news. The good news is us posting on social media and being really active on social media helps not only spread ideas and, help others get this information that they truly need and can't get it from another place, but also it's really creating communities. There's tons of communities out there. There's people that are struggling with autoimmune diseases, getting people that are struggling to get access to care, you know, working moms, working dads, those sorts of things. So it's really all these communities that we are creating and spreading information in. That's such a big component of social media that I absolutely love and is my favorite part of it. Now, getting a little bit into the bad, we have a little issue, as he and both Melissa touched on today, was that misinformation piece, right? And maybe it's not even misinformation, but it's information in the wrong context. People aren't necessarily getting the full picture of what they're seeing online, or they're getting information from what they think is a credible source and is not actually a credible source. And one of the ways to really combat that, and honestly, I do a look through my social media people that I'm following probably once every couple months. Because when you're scrolling, you're like, wow, that's really interesting. Let me give that person a follow. And maybe you just don't really think about, who they are, where they're getting this information from, that sort of thing. So I kind of go through like my influencer list and seeing who I'm following, any of the big corporations that I'm following, and I really look into where are they getting this information from? Are they a credible source? Are they, linking those important studies and things like that? Where is this information coming from? And that really helps me make sure that I'm getting the right information, I'm sharing the right information, and I'm not leading people astray or giving them that information in the wrong context. And somebody just commented, do not blindly repost. 100%, please don't do that. You know, I think the new fad right now is there's a lot of these, Instagram people or whatever, and they post like they're like funny studies or something, and it's like 100% found out that like if you listen to your girlfriend, you like live longer. Like that's really funny, but sometimes we get studies that are really leading people astray and, giving them the wrong information in the wrong time and really confusing, the people that rely on us to give them that information. So really just making sure that what you're posting is credible and what you're posting is really in that perfect context sort of thing. But also, don't drive yourself crazy too. I know it's a lot to not only repost, but to then also make sure the information you're seeing is correct. It can really take a toll on a person. So definitely make sure you're doing that in spurts. You're not on TikTok 4 hours a day. I really don't take my own advice myself. So, so I'm sorry that I'm giving you that advice because I tend to not take it, but definitely making sure that you're not wearing yourself out at the same time. And then that really takes me into the ugliness of social media, is that burnout. I think it was Melissa that said they don't have, I'm sorry, I can't remember what it was. I think it was Facebook or something. I'm not sure. And then Key also saying how they have, specific platforms that are really important to them and maybe don't get on some of the other platforms. You know, for myself, I don't have a Twitter account anymore, or X now. I don't have a Twitter account. It was too much for me. You know, it really tended to burn me out. So, you know, switched more to Instagram and TikTok and those sorts of things. So really just making sure you're taking breaks from social media and knowing that it's okay to step back. You know, you can't be at 100% 24/7. And you can also, as he was talking about the different roles that we have in social media, don't be afraid to switch your roles if one's too much and one's, you know, taking a toll on you as well. Just really making sure that you're giving yourself grace in this moment where we have so much information going on, and not letting you wear out. We want everyone to use social media, but we don't want it to become a burden as
Thank
well.
you so much,
And
Emma.
then
Oop,
just lastly,
sorry.
yeah. Oh,
No, you're fine.
sorry. Just
No,
yeah,
go ahead.
I just wanted to say really quickly, the biggest thing I learned about being in different spaces was communication is key. When you post something, you're reaching a lot of people that maybe don't have the same expertise as you or the same knowledge. And that sometimes can be frustrating as well, not knowing how to put it in the right words. But it's okay. Just you're doing your best and just really making sure that when you're posting, you're keeping others in mind and making sure you're communicating that information in a way that everyone can understand. Thanks. Sorry, Guy.
Thank you so much, Emma. Don't be sorry at all. That was such great information. And in terms of, I love that you touched on burnout, which is such an important thing for us to recognize that we're keeping ourselves healthy. We're not asking you to go out, 10 hours a day and just fiend for information on the internet. No. Protect yourself. And also so we want to illustrate that when used in a healthy dose, social media can actually sometimes recharge our batteries, because we do sometimes, the loneliness of being an advocate or a caregiver of patient can really be draining. And oftentimes we can use social media as a place to connect with others and be seen. In our last 2 minutes, the questions that we have I can actually answer pretty quickly. Kathleen, what is Blue Sky? I don't think you might have left, but Blue Sky is a lot like X or Twitter, but instead of being owned by one person or a company, it is owned by all of its users, which makes it really cool. We are on Blue Sky. It is not necessarily, we do a lot of event updates, like just live event talk chat on Blue Sky, but you can still find information there. It's definitely not the cornerstone of our educational library as all of the other listed platforms are. Marion, we would love to set up a meeting if you're still here. The toolkit that you will receive shortly will have more information on how influencers can incorporate NPAF into their content, but we also are interested in partnerships. It's so awesome to even connect in this fashion where you have done this amazing work of sharing your story directly about being a patient. And in terms of what is the right information you can share, well, we're hoping we can be that source. Everything, like a long time ago in a land far, far away, there was a thing called fact checking, and every single media outlet did it. And if you didn't do it, there would be problems. But that's not how it is anymore. But you can rest assured at NPAF, we fact check to the best of our abilities. And we always do our best to only put things out when we have the best information possible. Everything in the toolkits will be updated. And just to close out, I really would love to hear everybody's feedback about our social media. As always, I encourage you, when it's possible, to engage with us on social media. It's always a direct line to one of us. And, continue to cultivate these communities so nobody has to go through any of this alone, whether it's advocacy, struggles of being a patient or a caregiver. We hope to be your home where you can connect with like minds and experience peer support and credible information. And thank you guys so much for being here.
Thank you. And as we wrap up, you'll see a link in the chat where you can share your feedback on today's webinar. We'd love to hear your thoughts, what you enjoyed, what you'd like more of, and how we can better support you in your advocacy work. A huge thank you to Melissa and Key for sharing their insights and strategies today. We hope you found the session inspiring and full of practical ideas for building community and be able to amplify the patient voices online. We also encourage you to take what you've learned and put into action. Please share our post, start the conversations. Thank you so much for everyone who did share a post. live and also started following us, because every click, comment, and share really helps make a meaningful impact. And if you have any follow-up questions or need additional resources, please reach out to us at action@npaf.org. And remember, we'll be sending the recording and slides so you can revisit anytime with tips and strategies we discussed. Thank you again for joining us today and everything you do to support patients to strengthen our community. We look forward to connecting with you at future events. Thank you.
Thank you all. We'll stay on for just a little bit more, just in case anyone needs to grab things in the chat. But just really appreciate everyone's time. Thank you to Key, Anita, and Emma for sharing those amazing tips too. Again, just appreciate everyone's time today. Thank you.